So Northeast Ohio, we are once again loving our fish fries.
Yep, had one last week. Depending on what you order, your heart will thank you. For more, welcome back Dr. Grant Reed from the Cleveland Clinic. How you doing?
Doing well. How are you guys?
Good.
Yeah, good.
Good. Thanks for having me.
All right, talking about fish fries, but not all fish is created equal, we should say, right? But they're good for your heart. There's a lot of good benefits.
Yeah, that's very true. So important that as we consider fish frying, that we try to limit the frying and try to maximize the fish. There are many benefits to fish consumption, and it's recommended that we consume 2 servings of fish per week. I'm guilty of not doing that myself.
Yeah, likewise.
I'm always trying to remind myself of doing that. But the reason why is because fish is the #1 source of omega-3 fatty acids. Omega-3s have been shown to have many cardiovascular benefits. So there's been studies showing a lower risk of cardiovascular death, of heart attack, of stroke with omega-3s, and fish are a great source of that.
Because it lowers inflammation, lowers blood pressure, blood clots, all that stuff. I mean, you don't realize what you're getting.
Yeah, exactly.
Is there a fish that we should try to avoid?
Yeah, so there are certain aspects of fish that are really beneficial, and the best fish are those that are high in omega-3s and low in mercury. So Atlantic salmon, mackerel, rainbow trout, whitefish, sardines, those are the good ones.
Okay.
And as we all enjoy, fish fry, try to minimize the deep frying because that will kind of, cancel out the benefits of the fish in some ways.
A lot of places do offer baked or grilled.
Yeah.
Exactly. Yeah.
When you talk about some of those things that are helping your heart, what is it actually doing within the heart? Like what is our heart acting like when we have fish? Yeah,
so the beneficial aspect of fish is really the omega-3s and the fact that most fishes are very low in fat, so it's a high protein food that can, through the omega-3s and others, reduce inflammation, reduce blood pressure, limit the negative effects of cholesterol on your body, and then limit the progression of coronary disease. The Mediterranean diet is a very popular diet. It's been studied extensively and shown to reduce the risk of cardiovascular events, and it's very high in fish, as well as fruits and vegetables and nuts. So that is always my recommendation to patients, is to follow the Mediterranean diet. And if you do that, you'll get enough fish and you'll have a heart-healthy diet.
Doctor, I don't think we have ever done a story that says the more red meat, the better. Yeah. So we're hearing that so much. So this is actually a good time. And even last year when I was diving into this for Lent, I started eating so much fish during Lent that I just really enjoyed it so much that got away a lot from red meat. Still do a little bit, but a little bit. So this is a good time for maybe people to try to make that transformation and to try to get away from red meat. Because we're doing stories all the time about even the connections, not just heart disease, which we have known for years, but even cancers too.
Yeah, absolutely. A little bit goes a long way. Many people don't really enjoy the taste of fish, or they're vegetarian, or they're vegan, or they have an allergy, in which case you can get omega-3s through plant-based sources like flaxseed, chia seeds, and nuts, as mentioned. But a little bit goes a long way. So if you can use this time of the year to move towards a bit more fish consumption, and then make permanent changes in your diet and cut back on the red meat, all things in moderation. If you have a nice steak every now and then, it's not the worst thing, but you can't do that every day.
A good juicy burger, but yes, not 7 days a week.
As long as you're following as close to a Mediterranean diet as possible, big changes happen negatively over time, little bits at a time, but also very positive things can happen if you limit your portion sizes and consume more fish, and you have a heart-healthy, exercise regimen. It'll move you in the right direction.
Should we address the tartar sauce?
I'm not giving up my tartar sauce.
You can have mine, it's okay.
Okay, so tartar sauce, go light on that, because that probably cancels out some of the good benefits too.
Exactly. Right? You'll still get the omega-3s, but the more saturated fats and the deep fried aspects of things that can kind of cancel out the benefits. So as you mentioned, grilling and baking are better, and they could be really tasty.
So don't drown your food.
Yeah, you got it.
Right.
Yeah.
Yeah.
And you're going to be on New Day Cleveland too, coming up?
We'll be, yes.
Excellent. We'll see you then.
Appreciate it. Thank you, guys.